This video is intended to train new users of the CrossBow fascial closure system in the use of this exciting technology. The CrossBow is different than the traditional Carter-Thomason device in two significant aspects. First, guide positioning, and second, suture retrieval. Concerning guide positioning, the traditional cone guide technique, which positions the guide relative to the skin surface, results in variation in fascial bite depending on the abdominal wall thickness. The CrossBow guide is not positioned against the skin surface, but is intentionally positioned relative to the fascia to promote predictable suture placement regardless of the abdominal wall thickness. The adjustable fascial bite technique can be employed to empower the surgeon to customize the bite of fascia. For healthy patients, utilizing the principles of tissue sparing with smaller bites may be beneficial, while older patients with compromised tissue may benefit from a more substantial bite to mitigate wound dehiscence. Concerning suture retrieval, the tedious task of fishing for suture intra-abdominally is replaced by the proprietary CrossBow snare loop technology. The snare loops enhance safety, provide ease of use, and reduce OR time. The CrossBow has two primary components, a suture passing needle and a guide. The CrossBow guide has unique flexible snare loops designed to capture suture. By simply pulling up on the blue ring, the snare loops are retracted. By pushing down on the blue ring, the snare loops are extended. The suture passer is equipped with a tong-style grasper, providing a large aperture for easy suture loading. Release of the plunger allows the grasper to securely capture either braided or monofilament suture. The unique positive release mechanism ejects suture from the distal end of the needle. These combined features enable efficient performance. The CrossBow guide has a pair of channels to align the suture passer to carry suture through the snare loops. The engineered angle of the channel provides a consistent, predictable bite of fascia for each suture placement. Simply retract the snares to capture the suture tails and then remove the guide to retrieve the suture from the site. The CrossBow guide has visual indicators to aid in proper positioning of the guide. A set of numeric hash marks along the side of the guide can be utilized to adjust the amount of fascial bite. Moving the guide up or down within the defect to align the desired hash mark at the level of the peritoneum can result in the prescribed bite of fascia. The second visual indicator is the blue stripe located just above the channel exit. For moderate to thin patients, the surgeon should verify the blue stripe is below the skin surface prior to advancing the suture passer. This eliminates the frustration of inadvertently puncturing the dermis. In cases where the blue stripe is observed, it is recommended to slightly alter the technique. View the video by Dr. Mara Hashimi demonstrating the tips and technique for moderate to thin patients. There are two primary procedural steps for using the CrossBow system. First, guide positioning, and second, suture placement, each with a number of sub-steps. Although the CrossBow is intuitive to use, it is important to be aware of the most critical sub-steps. As described earlier, moving the guide up or down to position the indicator hash mark at the level of the peritoneum to achieve the desired bite of fascia is crucial. Another important step is stabilizing the guide with the non-dominant hand. Keeping the guide steady will ensure proper stitch placement. Lastly, a distinct step, unlike the classic Carter-Thomason technique, is loading and passing the opposite end of the same suture down the contralateral channel of the guide for the second pass. Let's review the steps in clinical action. Retract the snares to hear the audible click. Then place the guide through the defect. Visualize the guide tip in the abdominal cavity. Extend the snares. Pull up on the guide to position the hash mark at the level of the peritoneum to achieve the desired bite of fascia. Verify the blue line near the Suture Ease logo is not visible above the skin surface. Stabilize the guide with the non-dominant hand. Enter the passer with loaded suture into one of the guide channels. Place first suture tail through the fascia and then release. Load the opposite end of the same suture into the passer. Maintain the guide stable with the non-dominant hand. Place the second suture tail through the fascia and release. Retract the snares to capture suture tails. View the proximal hub of the guide and ensure the suture has been freed of both channels. If needed, manually direct the suture through the slot of the channel to free the suture. Remove guide from defect. Extend the snares to release the suture tails and throw appropriate knots. As witnessed, using the crossbow is simple, safe, and effective. For further assistance, please contact Suture Ease at 408-459-7595 or visit our website at www.sutureease.com.